Patrol Region C have administered at a minimum, and the reason why I say at a minimum is we're still trying to figure out what the contribution is to some of the nursing home data and things like that. So at a minimum, though, it's 820,250 total doses that have been delivered in our region. And so that includes around 525,400 first doses and around 309,523 second doses. So quite a bit of vaccine delivered within the area. So in addition to that regular supply of vaccine that's coming through the region, through the state, as most people have heard, there's also going to be an 8-week FEMA vaccination event going on downtown, which is really exciting news. So starting April 7th, as many as 3,000 people a day can get vaccinated at the Dome at America Center, and that's through our partners at FEMA. So if you haven't already, please register on the state's vaccine navigator so you can schedule an appointment at the event or any other mass events that are occurring within the region. Make sure you check with that county's health department website or the state's website. And you can find the details and the links to register at covidvaccine.mo.gov. So that's covidvaccine.mo.gov. And if you can, please help out friends and family members too who may need some help in signing up. So as we have done a couple times in the past, we also like to show, hey, what's the pace of vaccination going? How has that been going? And how soon do we think that we can vaccinate a significant percentage of the population? Or what some people refer to as herd immunity. Now, it's a little bit of a loose term, but at least we can put some numbers to that. And so this graph shows how soon we'll be able to get at least one dose of vaccine to around 75% of the adult population in the metropolitan area. So right now, our vaccination rate in the metro area is around 77,000 doses per week. Now, if we continue at this pace, we believe that we'll reach around 75% of the population in the metro area around the last week of June. So we have penciled in around June 20th, but you always have to factor in whether there's bad weather, whether there's any eruptions in supply, any of those other things. But if we keep going at this consistent rate, that's a reasonable approximation for that 75% of the 18 and older. Now, if we look at Missouri Region C, it's a little bit different. The current pace is a little bit lower. It's around 60,000 vaccinations per week. And so, of course, that pushes then the date back a little bit. And so if we continue at this pace, then that 75% mark of 18 and older is, again, around that last week of June, around June 27th. But again, it still depends on vaccine supply, whether there's any interruptions, anything like that. But it also doesn't account for if there's any vaccine hesitancy. So reaching that 75% number could become more challenging as if people are hesitant to receive vaccine. Now, anything that increases supply or increases the ability to vaccinate people, of course, it's going to push that date further to the left. So we had reached that percentage sooner. But we'll keep an eye on that and keep following the numbers and see where we end up. And again, and we'll talk about this here in a minute, that doesn't include people under 18. And so people have been pointing out that it's hard to reach that herd immunity population when you still have a significant percentage of children or people under 16 that aren't getting vaccinated. So we'll talk about that here in just a minute, but it's a good point. So I wanted to share with you as well this interesting graph. It was from the Missouri Hospital Association. And so the reason why I'm including it is I was asked a couple of weeks by somebody in the media about are we seeing any differences in our admission patterns based on our vaccinations that have been going on. And it turns out that we have been. So this is, of course, from Missouri Hospital Association, which uses statewide data. And so what you see here, that solid orange line, is the population that's greater than 60. The solid blue line is the population that's less than 60, or 18 to 59, I believe. And so you look at those, the solid lines are the percentage that make up the total amount that's been hospitalized. And so as you can see, the percentage coming down for that greater than 60 and going up for that 18 to 59-year-old, which makes sense. when you look at the dotted lines. So the dotted lines look at how much vaccine is being delivered per 100 persons within those age categories. So if you remember back early on when we were prioritizing all of those age groups, 75 and older, 65 and older, so on and so forth, that we've ramped up the percentage of people that have been vaccinated in that age group. And so as we've done that, their hospitalizations have come down as well. And so now the higher percentages that we're seeing are coming from those age groups that are less than 65. And we've seen that playing out here in the St. Louis area as well. We're still going through some of the data, but I can see just grossly looking at the data that the amount and the percentage of hospitalizations in the 65 and older age group have come down significantly more than the other age groups that we look at. And so not only are we seeing an absolute decrease in the number of people age 65 and older that are being admitted to the hospitals, but as a percent of people that are hospitalized, they're also making up a smaller percentage of people. So this is really just to show the effect that vaccines do have on protecting the public and protecting the elderly from hospital admissions, from ICU, and ultimately from death, which is the outcomes that we're always concerned about. So just an interesting graph to show the impact of vaccine. And then secondly, as I mentioned before, is vaccination of children. And so this was released today about the Pfizer BioNTech COVID vaccine. And what it showed is in their studies from 12 to 15-year-old that it's extremely effective, and even more so than in adults. So they did not find any infections among children who received vaccine in their most recent clinical trial. And it produced a strong antibody response and no real serious side effects. And so the company announced that they're going to be submitting data to the FDA to expand those limitations on age groups that can become vaccinated. Now, it still takes a little while to work through the bureaucracy at the FDA, but nonetheless, it's exciting news that the vaccine has been shown to be effective in that 12 to 15-year-old age range. Now, there's also ongoing trials for children that are younger than 12 as well, across all three of the different vaccines that are now available, so the Pfizer, Moderna, and the Johnson & Johnson. Those trials are ongoing right now, so we won't expect results till later on in the year, with the expectation that vaccines for those younger age groups would probably begin early part of next year. But we'll see how that timing goes. But anyway, it's exciting news about vaccinating children. As we've mentioned before, it takes a lot of people to distribute vaccines, as you've seen from those mass vaccination events that are occurring across the metropolitan area. And as those doses increase and as the pace of vaccinations increase, those local health departments are in more and more need of volunteer to help administer those doses. And so these are some websites where if you're a clinician or just want to volunteer for things like directing people or helping out with paperwork, then the public health departments could really use your support. Now, the U.S. Department of Health and Human Services recently announced that more care providers, including dentists, midwives, optometrists, podiatrists, respiratory therapists, and some students are now eligible to administer vaccines. And so if you're interested in volunteering, please reach out to your local health department and the Gateway Volunteer Network. They could really use your help. So moving on now to our hospital admissions. So let's turn to some of our data. Today we're reporting our daily admissions number is 35. And remember, that's delayed by about 48 hours. And our 7-day moving average is also sitting at 35. So as you can see, looking at the graph there, we've somewhat plateaued. Well, not somewhat, we have plateaued in our admissions rate. So hopefully, as vaccinations continue, and if we continue our mitigation strategies, we can get that number to continue to come down. But right now, we've sort of hit that plateau. And that's sort of a continuing theme here. So today we're reporting 213 hospitalizations with confirmed COVID patients. And that moving average now is 222, and you can see how those graphs are remarkably similar with sort of that stagnation. A little bit more detail about our numbers. As I reported, we have 213 patients hospitalized today with COVID. We have 54 patients in the intensive care units, and we have 36 confirmed COVID patients on ventilators today. Looking at our suspected COVID patients, we're reporting 25 patients hospitalized today suspected with COVID. We have 4 patients in our ICU that have suspected COVID, and we have 4 suspected COVID patients on ventilators today. Looking at our discharges, our good news slide today, we're reporting 36 COVID patients were discharged yesterday, and that brings our cumulative total to 20,517 COVID patients discharged from our task force hospitals since April of last year. So since about a year ago, we've discharged over 20,000 COVID patients from our hospitals, a remarkable feat. Unfortunately, we still have people passing away from COVID as well. So today we're reporting 7 COVID deaths in our task force hospitals, and that brings our 7-day moving average up to 5 per day. A little bit of showing, again, we run our models on Thursday of every week, so this is our latest model. We haven't really updated this model for about a week and a half, or I'm sorry, about a month and a half. And the reason for that is the numbers are tracking along well with the model. So you can see sort of that gradual decline. We have, when we take a look at the model this week, because of that plateauing of numbers, we'll see if we need to adjust that at all. But it seems to be following along with our best guess. And then taking a look at our Epicurves, it's fairly consistent. There's been a lot of stagnation or plateauing across the region. Some have seen some increases, not by huge amounts, but still enough to where you're concerned about this ongoing transmission occurring in the community. So we'll continue to keep an eye on that. And it's fairly similar across the major metropolitan areas across the state of Missouri. So either flat or slight increases. Taking a look at our scorecard, so good news to report here with green numbers across the board for a total number of COVID beds being around 5%. And our ICU beds, and I think this is the first time we've actually said this on our press briefing for quite some time, is down below 10% now for our ICU capacity. So that's good news. Not a huge, not significantly below that 10% mark, but it is down below, so that's good news. New admissions, as I mentioned, we're at 35, and you can see where we've plateaued right around there. Our prevalence of reported cases, and again, this is going to be reflective of our cases either staying the same or increasing slightly because it compares the most recent 14 days with this rolls up the previous 14 days. So anytime you're not declining, you're going to be either sitting flat or increasing, and so we're sitting at 1.9 right now. And the same thing with our weekly change, or it's actually a 14-day change. So anytime you're not decreasing, it's going to be somewhat flat or it's going to be going up. So we're sitting at around 1.5% right now. Our testing, again, has tacked up as well, and that fits along with this narrative of we're seeing cases either flat or increasing. So we're reporting a positivity rate of around 9.7%. And this is, of course, from the healthcare systems lab, so this doesn't include the health department labs or sort of independent groups labs either. But it's a fairly good sample size, and so we know it's consistent with what's been going on out in the community. So again, it's a little bit concerning that we're creeping up with this number, and this is usually a leading indicator for other things such as hospitalizations, things like that. So we have to make sure we're doing all those things that we can do to prevent spread. And then lastly is our transmission number. It's up above 1. Again, reiterating, anything above 1 means continued transmission in the community. Anything below 1 means we're interrupting transmission. So we need to get this number lower. We need to get that positivity rate lower, and that will then impact our admissions and our hospital census and get us back on the right track. So finally, we'll close today's briefing with a few reminders about prevention. And so while the COVID cases and hospitalizations are still low, we're seeing some uptick in some areas. Now, nationally, we've seen around a 20% increase in cases over the last 14 days. And I think the data that I've shown you today says the St. Louis metropolitan area is no different, although we might not be experiencing as much growth as there is nationally. We are not going down either. So we know from experience how quickly those case numbers can ramp up as well. And so we need to do really everything that we can to prevent that from happening. And so that means continuing to do the things that we've done for the last 8-9 months. Avoid indoor gatherings and travel, wearing masks and washing our hands frequently, and getting vaccinated when it's our turn. So this week, many families are thinking about how they will safely celebrate Easter and Passover. The safest thing that we can do is to celebrate from home with the people you live with, or with another household if you're fully vaccinated. Now, if you do gather with others that aren't vaccinated or that are significant risk, make sure you wear your mask or gather outside where it's more difficult to spread the virus. And these simple steps can really make a huge amount of difference. And if we all work together, if we can keep the number of cases low, we can get to that immunity faster and get back to that more normal way of life that we like to share with our families. So with that, I'll conclude my remarks and we'll take some questions from the media.
Which vaccine do you think will be used on children under the age of 12, and a possible time frame when it will roll out?
Yeah, so all 3 of the vaccines that are currently available underneath the emergency use authorization, so Pfizer, Moderna, and Johnson & Johnson are all doing pediatric trials right now. Now, the trial that was announced today was the first one that was completed, that 12 to 15-year-old with Pfizer, but all of them are going through trials right now. From everything that I've read, they're most likely not going to have the data until later on this year, so the second half of this year. And then, of course, it's analyzing the data, submitting the data, going through a review, and then getting approval by the FDA. So right now, the earliest projected for that age group, the younger than 12 age group, is early part of 2022, which seems like a long way off, but they're moving through those populations quickly, but that's the timeline that they've been giving out for those vaccinations.
Where do you think we stand on the rollout as of now? We know it was slow in the beginning, but 3 months into the new year, where do you see the St. Louis region?
We're still, I think, playing some catch up from earlier in the year. We're still seeing significant demand, so it's a little bit difficult question to answer because we know that there's a significant portion of the population that traveled outside of the St. Louis Metropolitan area as well to go get vaccinated, and so we have some amount of the population that's been vaccinated here locally, some that has traveled outside of the St. Louis Metropolitan area to get vaccinated. But I can say that in discussing our vaccination clinics with our teams and with the other teams from the task force hospitals, that it's getting more and more challenging to fill slots. And so what I mean by that is we're inviting a lot more people to come in and get vaccinated, and we're having to invite a lot more people just to fill the same number of slots. So they are getting filled. It's just trying to find more and more people to fill those slots. So I think it's going well with the increase in vaccine that's going to be coming our way with the FEMA clinics and with the increased allocation coming from the state. I think it's going to ramp up rather quickly, rather soon. And so, we're in a good spot right now. I showed you from the data, we believe that we can get to that 75% mark around the June timeframe. It will most likely be sooner than that, just because more vaccine will be available. But still, it depends on a lot of things going right. And so you never want to, sort of overpromise, but it's looking good.
That concludes the list of questions received from members of the media prior to today's briefing. Thanks for watching.